we have Tyson this morning who came and talked about cybersecurity in healthcare, which is a topic we haven't done before in our morning rounds. So thank you, Tyson, for doing that. Really appreciate it. First, you mentioned 3 major threats in healthcare today. Could you briefly describe what those are?
Yeah. So the 3 threats that we talked about were ransomware, which is where bad guys are able to get into your data and kind of lock you out of it, right? So they kind of encrypt it or protect it in a way that you're unable to access it without paying the ransom, right, or paying them to get access back. So we talked about that. We also talked about phishing, which is kind of something that I think everybody out there is experiencing nowadays with fake emails or fake messages, whether it be through social media or text, what have you, right? Bad guys just trying to get information from us or trying to get access into a system or our phone or computer or something like that, right? So that's phishing. And then the last one we talked about were cloud vulnerabilities. And so even though nowadays there's a lot of systems that are cloud-based, which means it's stored in another company's environment, such as Microsoft or Amazon or Google, there's still vulnerabilities and there's still things that we need to do to kind of help protect that data, right? And so we talked a little bit about some of those vulnerabilities and ways that we can protect that. So
if I'm a patient and I'm worried about my own privacy and my own data, what things should I know about the things being done right now to protect that data?
Yeah, so if I'm a patient, some of the things that I'm going to do myself would be to help kind of protect my own accounts and protect my own information, right? Whether that be having certain protections on my email or even on my identity with, identity protection. If I'm worried about my patient information with like my healthcare provider, I would probably just ask my healthcare provider a couple of questions on like, what are some of the things that you do to kind of protect my data? Are you using 2-factor authentication on your systems? Are you following HIPAA guidelines, or do you have a security framework that you're using? Those are some things that maybe the typical patient might not think of asking, but are good questions to ask a company. So,
speaking of the 2-factor authentication, that's something that has been going on now for a while, and you had a good analogy or two when you described its importance. It's inconvenient, but it's safer.
Yeah.
And every time I have to go through the 2-factor to get into the EMR or into the PAC system to look at imaging, I'm reminded that we do these extra efforts to protect patient data and to make it as secure as we can.
Yeah, I always like to say that security and convenience don't like to go together, right? They're usually going against each other. But 2-factor authentication sometimes is a good mix where you can kind of find a way to do it where it's not super inconvenient, or you build the habit, you get used to it. But then the payoff or the benefit of it is there, right? But yeah, security and convenience are those things that just they're against each other, right? So, but yeah.
As healthcare providers, what advice would you give us to be a good defensive player in this environment?
Yeah, the biggest things that I'd recommend, one, be proactive instead of reactive to cybersecurity needs. So create a good framework, implement the right systems, do the right kinds of trainings, have the right policies, and kind of be proactive to it instead of just reacting to when an incident occurs, right? Because oftentimes you'll be so glad that you put some of these things in place because when the incident happens, you'll be like, oh, thank goodness nothing happened. We're good, right? We had the right things in place. Versus the opposite, which is, oh man, I wish we would have put that in place, a month ago or 6 months ago. Aside from that, I always recommend companies do trainings with their employees, right? So make sure employees understand the threats that they're facing on a day-to-day basis. They have the tips and tricks to kind of help them identify some of these fake emails or messages, or even social engineering that can be done by people calling into the clinic, right? And then lastly, just use technology as a good resource. So make sure that you implement a layered approach of technology where you're not just focusing on things that prevent stuff from coming in, but you're also focusing on things that detect when something bad has squeaked through, right? Or have good things in there for a response, in case something happens, right? So those are probably the things that I'd recommend the most.
Thank you so much for presenting this morning. Just on a little bit of a personal note, this whole cybersecurity environment it's a little bit scary.
Oh, yeah.
And it feels unnerving almost to think that people out there would maliciously try to get your information, your data, steal your money, and can do it in ways that you had never really thought of before. Just a personal story, my kids went to California last summer, and after they got home, I got a letter from the state of California that said that I had an unpaid toll. And I talked to the kids about, did you go through the toll booths? Did you pay when you went through the tolls? And they had no idea what I was talking about.
Like, what's a toll?
What's a toll? We don't have these in Utah.
Yeah. And
so I thought, okay. So I ignored the letter and got another letter, and it was, if you don't pay, you're going to have a fine. And it seemed legitimate, and there was a story behind it, so I went ahead and paid the fine, and not the fine, but the original toll, which wasn't actually a lot of money. And then recently, I think a lot of people have been getting text messages that say, you have an unpaid toll, and if you don't pay now, you're going to be subject to huge fines. And when I first got those, I was like, wait a second, I paid that toll.
Yeah.
And it caught me off guard, and I think some of the trainings that you've done with us and just some common sense and a little bit of alertness was like, this isn't real. The letter from the state of California, that was legitimate. That was real. This text message, it's not real. And to just have that awareness of what is actually real and what is somebody trying to take advantage of you is something that we just need to be cognizant of.
Well, and it's pretty crazy because these bad actors or these bad guys now, they use these psychological manipulation techniques, right, to try to get us, and they really prey on like our empathy, and they prey on our respect for authority, and some of these things where just for the past 20 plus years people have been like, oh well, if you say that you're from the government, then I'm gonna believe you. And nowadays bad guys are preying on this, and that's what makes them so successful. So it is sad, it is scary that that's what they're doing, and that people don't know better. And so awareness is key. And so that's where these trainings and things kind of come into place.
Well, thank you for helping us keep our data and the patient's healthcare data safe, and our healthcare system, the electronic part of it, secure and functioning, and for helping us understand our vulnerabilities and where we need to be careful.
Yeah, of course. Thanks for having me.
Yep.